Hey guys, we're going to talk about healthcare today, so I know you're tuning out right now. No, I'm teasing. We have a return guest and a sponsor of the show. Casey, can you go into a little bit about your company, your website, and what you do specifically that's so unique? And we're gonna spend a whole show on it. And you brought a book, and I went through the book. But before that, I want to know exactly, like in a simplified version, of how you're different than normal healthcare.
Yeah. So at its most simple version, direct primary care is a membership model care. A lot of people give the analogy to concierge care, but it's a lot more affordable. And for instance, my clinic is $75 a month, and it covers all of your primary care needs. And so it's taking basically the power away from the insurance company for all of our routine healthcare and putting it back into the hands of not only the provider, but the patient themselves. And so the quality of care goes way up. And it's a lot more personalized and extensive. So
quality of care goes up, costs go way down.
Yep.
And that's what we're going to talk about today.
It's very simple. It doesn't sound possible, but it's working all over the country.
All over the country, yeah. And whenever you think about this, it's almost like when the first time you had shared it with me, I think you sent me a LinkedIn message and then an email or whatever. Yeah. And so I started looking into it because I'm like, this doesn't even feel like it's real. Right. I get
that a lot.
It's so, and specifically today, if you own a company, if you're a business owner, or maybe you're a CEO, CFO, maybe you're in the HR department, we're going to get into that a little bit on human resources because the book talks about that pretty heavily. But whenever you're looking at you being a business owner and you're looking at the cost of healthcare, and I have the stats, so we'll get into all that. But one of the big things with you guys is like, really, for an employee, it only costs that much. And there is a difference because you're primary health care, but if there's emergencies or something like that, that's a whole different ballgame.
Correct. So primary health care, routine health care, chronic disease management, that's going to cover 80 to 90% of anyone's healthcare needs. Right. There's still that 10, 20% that might need to be covered. And that's where health insurance applies. That's where it belongs. We don't expect a car insurance company to change our tires or change our oil. We expect them to come into play when something catastrophic happens. And that's how health insurance should be. I also have some lower cost catastrophic options as well that maybe we can talk about on a different episode. But
yeah, that would be cool. So if I'm let's say I have a company of 20, 30, 40 people and I'm looking at getting healthcare, what would benefit from me going to you instead of using I have these brokers and all that stuff coming in. What would be the difference? And then we'll get into the book.
Yeah, no, some brokers, some of your more cutting edge brokers, they're familiar with direct primary care and they use it in their list of services to help companies. And as it becomes more well known, and in fact, the book we're going to talk about is written by the founder of Health Rosetta, and he's big into healthcare brokers getting a flat fee and not looking at getting percentages and they get incentivized inappropriately to make decisions that might not be in the employer's best interest. I'm not vilifying brokers. I'm not saying that they all do that, but they're certainly incentivized to do things.
So it's like selling you an annuity or something like that, where they get a huge percentage instead of now on the financial side of things, you have people that are just getting flat fees.
Yeah. And in fact, the financial side of things, if you're using a broker on that, they're required to inform you how they make money. And health brokers are required to do that too. They just don't. So there's a lot of smoke and mirrors. Health brokers are not the villains necessarily, but there's a lot of smoke and mirrors in healthcare. I think everybody listening to that knows that. They just don't know where all the smoke and mirrors are.
And the book really shows it out. I wish they would have got a little bit better on the title because it's kind of, I don't like the word CEO. Yeah. But just put your name in there, or whatever you are, if you're a CMO or, whatever it may be, just a business owner. Because I think even me, just having a very small business, I read the book and it was so informative just on what's going on. I didn't realize how large of an issue this is.
Yeah. The book is called The CEO's Guide to Restoring the American Dream, which really kind of doesn't tell you what it's all about, but it's really about how companies need to take back healthcare and deliver better healthcare at half the cost of their employees and use that money savings towards raises and different programs for their employees. Right now, employees aren't even getting raises because every year it's 10, 15% more for healthcare and everyone just accepts that.
And what I like about the book, I think more than anything in the beginning he talks about is that, yes, healthcare is expensive, but there's people and experts that have accomplished lowering costs. Like it's been done. This isn't something that's kind of in the works but there's actually companies that have done this. And then you have companies.
Yeah.
And it's like, what is the process of somebody that says, okay, I'm interested, and I know they can contact you and you have a whole page of it on your website, but what is the process if somebody wants to is the best thing to do to go on your website and read it, to get this book and then call you, or?
Yeah. So I find every company is just a little bit different. And so it's best to schedule a free business review with me or my office manager. And we look and say, okay, how many employees do you have? What are your challenges? What are you offering right now? How much is that costing you? What are your goals?
Right.
And then to say, okay, this is how we can best fit you. And maybe here's some of the challenges. And maybe there's probably like 1% of companies that we might not be a good fit for. But for most companies we fit, we just have to kind of adjust it, just nudge it right or left to fit the company.
Yeah, and the book, The CEO's Guide to Restoring the American Dream, Dave Chase, because I always like looking at who authors are, because anybody can write a book on anything. Mm-hmm. But he's considered one of the most influential people in healthcare strategy. And like you said, he owns the company. Yeah. What's the company?
It's called
again?
Health Rosetta.
Oh, okay. So it's like Rosetta.
Basically trying to translate healthcare for everybody.
That's crazy. And so what the book mainly goes into is the problem of, and I like this word, hyperinflated healthcare costs.
Right.
So
peeling back the layers on that.
Yeah,
why is that?
Why is that? Yeah, that's great. Yeah, and I think that's one of the biggest things. So I kind of want to get into if you're a doctor, nurse, and I know, a clinician, a professional or whatever, why is just regular healthcare so expensive?
In my opinion,
yes.
And I'm a nurse practitioner, I'm not a business person. One of the great things about David Chase, the author of the book, is that he is not an MD. He's not in the system. He's actually coming from a business side and looking at it. Mm-hmm. But in my opinion, and I think David Chase would probably agree with me, it's lack of health, it's lack of transparency. You can't walk into, well, you can, but I'd have to train you how to do it. But you can't walk into a typical place and say, how much is this going to cost me for some sort of health related item? The front desk person has no idea. They're not being difficult. They don't know what it's going to cost you. And typically the answer you get is, well, what health insurance do you have? And that's not the right answer. The answer is, how much does this cost? And then I can make a healthcare decision based on that.
So they're just like, what? And the reason they're saying that, and what I learned is because they're just billing.
Right.
That they don't know.
They don't know.
If there's 30 different health insurance, and then you're billing each one, and then they get then you're, I guess as a doctor, you just get money back from, but you don't, does anybody really know the true cost of any of it?
In a complex way, yes. We do know how much it costs to get an x-ray. We do know how much it costs to do a thyroid panel. But if you have insurance in between you and the provider, there's all these smoke and mirrors and hyperinflation of costs that are then going to get discounted on the back end. So the person thinks they're getting a discount when they're really not. They're getting a discount on something that's astronomical. And I don't know if you remember, but I had sent you a sample of what labs cost.
Yes. Yeah. Let's go through some of those real quick.
Okay.
Because I think that's kind of cool. I know we had this in our last episode, but I've got a lot of new listeners. So
yeah. So a typical panel of labs, I ran it through our lab company, and I made it look like there was an insurance policy. And so the prices went way up. And so a typical panel, we're looking at metabolic, CBC, thyroid, the cholesterol, and vitamin D, and it's $1,316. And
that's through insurance.
Through insurance. So if you're paying 20% of that, you do the math, you're paying $250 for that. 20% is a typical one. But at my clinic, it's $97 for those labs. So you're paying less without insurance than you are with insurance.
That's the problem.
That's the problem. And it's because you don't know what that costs. You don't know that those labs should only cost you $97. You see your explanation of benefits on your labs and you say, wow, I'm really glad I have insurance because I can't afford $1,000, $1,300 for those labs.
I mean, that's a huge difference.
Huge. And I have to print these out so I can show people that I'm not making these numbers up.
Right. Because it just floors me, like, to think that something would cost that much more. I mean, hundreds and hundreds of %.
Yeah. And this is the same lab, the same tests, and I'm using the same lab.
So there's not like a different door that you have to go through. You don't have insurance, so you're going, this person doesn't know how to give
It's
the
the
blood.
same test. It's the same technology. It's even the same lab doing the test.
And one of the things that he talks about in the book and I think, and he says in the book that he decided to focus on employers and unions for practical reasons. Uh-huh. And he said the overwhelming majority of non-poor, non-elderly get their benefits through their job.
Correct.
So whenever you begin to look at it through that lens, now you can start seeing the situation of what begins to happen over years and years.
Right. And that's kind of where it all started. Where the problem started is employers weren't able to raise wages during World War II. There was some limits, but they were able to do fringe benefits, and health insurance was a fringe benefit. And so they started offering that to employees, and that's kind of where it all started. And that's when people started not understanding what things cost.
Right.
And so prices go up when you don't know what they cost.
And that's what he said. He said, as a general rule, employers and unions and public sector employers are ineffective at purchasing high value health benefits, like the negotiation part, the business part of it. They're just looking out for, if they're a good person, they're looking out for, their employee, not necessarily cutting negotiating deals and stuff like that.
Right. But the poor HR person that's looking at claims and benefits, she doesn't know. First of all, she doesn't know, is the thyroid test an appropriate medical test for that person, for that situation? Is this medication the right medication for that person? Second of all, he or she doesn't know what that's supposed to cost,
right?
Either. So how could you negotiate that? You don't even have anything to start with.
Yes. And the cool part he talks about this is that employers and unions now can innovate independently without an act of Congress, and that you can actually we can actually take the power back from what's been happening in healthcare, and we'll get into that a little bit. But one of the things that, and maybe you can pull the lid off of this, because he says it's a deep mystery. So how did you say World War II, people employers are starting to offer these benefits. Well, then how did this soup turn into such a screwed up mess right now?
I don't really know all the layers of how that morphed into where we are now.
Right.
But it really, and I think it's somewhere actually in the book, but it all comes down to price transparency. If we know what something's cost, so a good analogy is you go to the grocery store and there's 2 boxes of Cocoa Puffs, and you pick
choice.
You pick you pick the one on the right, and you go home and you get a $300 bill a month later.
Right.
What you didn't know is the Cocoa Puffs on the left was only $5.
Oh yeah.
And had you known that, you would have picked the $5 Cocoa Puffs. I'm pretty sure. And so that's kind of what's happening is you don't get to make a choice because you don't know what something costs, and people get away with it.
Yeah. And then no one challenges them.
Yeah.
And one of the things that he talks about is it's a healthcare sector. We're always thinking of, like primary care or whatever, but you have drug companies, you have device companies, you have the care provider organizations, but then you have the insurers, the health plan administrators, the health IT firms, and they all want a piece of the pie, and they begin to extract money from.
Yes, absolutely. I've had many business level people come to me and tell me I needed to see more patients. And my initial thought always was, well, what if we just got rid of your salary? I could probably see less patients, and the company would still make the same amount of money. Because
administration's a big one.
Yeah, because at the end of the day, the provider's the only billable provider. They're the only person bringing in the income. And so everything is aimed at extracting more and more out of the provider, and the patient suffers.
Yeah, I mean, and
that suffers too.
And then especially with you guys, as far as like where you're at, I mean, just being able to, talk to my friend today went and did a Zoom call with a doctor, and he was like, after about 5 minutes, he was in a hurry. And he got probably about 8 or 9 minutes from him. Wow. But it was just crazy that my friend said, well, I got like 8 or 9. He was happy to get 8 or 9 minutes from the doctor through a Zoom call, where you guys are, 20, 30, 40 minutes.
Oh yeah, I'm spoiled. I don't know how a provider, doctor, nurse practitioner, I don't know how they get through an appointment in 8 minutes without making a mistake or missing something entirely. We have 30 minutes, and sometimes I feel a little stressed about that. I need a little 15-minute break there to catch up.
So you guys are spending 30 minutes.
30 minutes for a follow-up, hour for a new patient.
Wow.
And then there's some breaks in there too to kind of keep us on time. We don't want to run behind.
So if an employer is listening to this and you want to provide quality healthcare to your employees and you're really concerned about your employees, being able to have your employee, what if an employee went to your clinic and then that would blow me away to spend 30, 45 minutes an hour with somebody. It's just a benefit. It's a true benefit. True. Why would you go to some other employer and go, you can't go back to the 10-minute visits.
No, I can't. And yeah, we lose very few patients, but from an employer's perspective, not only are their employees getting outstanding care, but for self-funded employees, and this was probably a whole podcast in itself, but direct primary care can save these self-funded, partially self-funded employers thousands of dollars at 30% on average. And if you've got a $100,000 budget for the year in your self-funded pool, that's $30,000 that you could do something else with.
Right. And that's something that, and we got into it a little bit, and we'll get into it a little bit more, but with the human resources, I like what he had in the book. He had a guy by the name of Arnold Roman, which is the editor of the New England Journal of Medicine. And he said this back in 1980, which, 1980 is a long time ago, if you really think about it.
Yeah.
I hate to admit that, but that is a long time ago. He said he was talking about that what is bigger than the military-industrial complex, which we know President Eisenhower and presidents have warned about this big military-industrial complex that we have. He said what's bigger than that now, and he said this in 1980, is the medical-industrial complex. And now we think almost 40 years from now, but as the book was talking about, we're up to like $525 billion. That's a lot of money. And one of the quotes that he says in the book, which I really liked, he said, I want to make sure I quote it right. He goes into and he says that we would go to war with other countries for that amount of money.
Oh yeah, absolutely.
And that's what's happening to America. Employers, these small businesses that are out there. And
companies are being harmed by health and health insurance. And they're paying thousands of dollars for something that their employees don't even feel like they can use.
Yes. Yeah, exactly. How often is it being used?
Yeah, it's a benefit that they're not really happy with.
And he goes on to say this in the article. He said, wasteful healthcare spending consumes 79% of household income growth.
Yeah.
79%. That just fathoms.
There's probably nobody that listens to this podcast that's never gotten a shocking healthcare bill of some sort. I know I have.
Yeah, exactly. I have the VA, so that helps or whatever, in the Veterans Administration because they disabled and all that. But when you really, and I know you were in the military too, but whenever you really look at it, I've seen like people that are just their prescription costs alone.
Right.
With the prescriptions that they have, like they don't hardly have any money for the month after, especially elderly and.
Yeah. And a lot of these prescriptions, they can be changed to something a lot cheaper. They can be split up if they're a combo med into two cheaper meds and with a much lower bottom line.
It's the same as the labs. It's like the same pricing from what you were sharing with me before.
Medications are definitely marked up from a direct primary care standpoint. We don't have as much leverage as we do with labs, but we are able to guide and direct and navigate through the system to try to save money. One area that we shine at is glucose monitoring. We're able to lower costs dramatically, and that's a big problem.
Yeah, just the like if you go, just buying the monitors themselves, and then the little strips.
Yeah, the monitors are free.
Yeah, well, because somebody was telling me the other day. I don't have issues with that, but they were saying, oh, you should keep track of it, and then you can see your energy levels and stuff like that, like write it in a book, and certain things you eat, and then test it afterwards, just to test. Yeah. But the strips
are outrageous, and they give the monitors free, so you use their strips. It's like printers and toners. But what is
less inexpensive?
What's
the strips with you guys?
We use a monitor that you pay for. I think it's $40 that you pay for, and then the strips are just infinitely cheaper.
Really?
Oh yeah, by hundreds of dollars every month. depending on how many times a day you test.
See, this is the part that's, it's just, the more I, like when I was reading this book and then the more that things that you share, it's just like, how is this able to even happen?
Yeah. I mean, an employer, if they're footing the bill, let's say $600 for glucose monitoring for one employee every month, and I can do it for 100. I mean, the math is pretty simple.
Yeah, that's crazy. And one of he talks about, which I think is really interesting, and I think if you have a business mind, you'd understand is the widespread conflicts of interest.
Right.
So you have healthcare insurers, providers, vendors, buyers, brokers, and advisors, and then they have tons of conflicts of interest. And he gives an example of this. He says, benefit managers generally hire benefit consultants paid by health insurers and providers. So he's like, that's a conflict of interest. And then this is the best way I love the analogy. He says, if Fred hires Bob to sue Joe would be off his rocker to hire Bob to defend him. Yet this is the kind of nuttiness that's happening with the purchasing administration and delivery of healthcare in America. So, I mean, that's just like absolutely nuts to think that that's how they interact with each other.
And what's a company to do? They rely on their broker to make these decisions.
Yeah.
They don't necessarily know. We were talking about marketing before this call. I don't want to specialize in marketing.
Right.
I want somebody else to do that. And I should educate myself a little bit on it. But at the end of the day, they're going to be the one that makes the decision and guide me through marketing. They're relying on their health insurance broker, and they're incentivized improperly often to make good decisions for the business. And Health Rosetta, they actually have certified insurance brokers. So, and there's nobody in New Mexico right now. I have a friend who's actually trying to become certified as a Health Rosetta broker.
Out of everybody that is in New Mexico, there's no one certified.
There's no one certified right now. In fact, I can't remember if David Chase emailed her himself or if it was somebody else, but they're talking to her. She had missed some sort of deadline in getting in, and they're talking to her because they're like, well, we don't have anybody in New Mexico, so we want to talk to you. And if you're interested in taking away all those layers and improper incentives and become a Health Rosetta broker.
But the problem lies in, like we talked about earlier, and with HR managers is you're coming in there to take care of the employees. Yeah, you've got so much. You got the hiring, the firing, the recruiting, building culture, all these things. The last thing you want to do is shake up the status quo of what's been around for years and years and years. What advice would you give to somebody that may be listening to this and they're like, you know, because we just do the same thing over and over again. You know, it's that insanity quote. You know, do the same thing over and expect a different result.
Stick with the status quo.
Yeah, stick with the status quo. And he mentions that in the book, and I'll get in it after that. But what's some of the things that somebody can do? I know they can consult with you, but how can they start looking and to get a realization of how much they're spending? What's the best way to do that? Yeah,
so as an HR person, the thought of adding some other layer of healthcare to your plate is daunting.
Right.
And trying to roll that out to the employee population without terrifying them, because it is really outside of the box thinking. It's very different. And so it's scary. But the nice thing is if you already have health insurance benefits in place, what we're proposing is that you add this direct primary care piece. And yes, it's $75 a month per employee. So it's an added cost item. But then we're going to pull all these claims out of this other column. You leave that column in place. Don't change it. Don't even change it from the previous year if you don't want to. Is we're going to pull claims, all those inflated claims, all those glucose monitoring claims, all those visit claims, lab claims. We're going to pull them out, and you're going to pay for them directly. And you're going to save 90% on some of them. And on average, you're going to save 30% between everything.
And you're providing your employees with better healthcare.
And they're getting a great experience. Right. We even have 24/7 telemedicine, and that's not because we're altruistic. It's because we want to keep your employees out of the emergency room. They can't even darken the doorway without a $1,500 bill. And 30% of ER visits the studies show that they're unnecessary. Mm-hmm. And so your 30% of your ER bills were unnecessary. They could have been deferred to telemedicine. A doctor could have talked to your employee at 2 a.m. and said, no, you could probably wait until the clinic opens, or here, do this, or here's a prescription, follow up with your primary care provider, and you actually really have one.
Yes, exactly. And so, because that's something different too. So you have all these people and they're so afraid, like they were talking about them being afraid to even go to, ER because of COVID and everything else. But you guys are more than happy to hop on a phone call.
Yeah.
More than happy to, do a video call, whatever it may be. The accessibility is there.
Yeah, and it's a $0 copay, so your employee has no reason to not go get care when they need it.
Right.
And there's no surprise bill after the fact either. There's no explanation of benefits. There's no insurance claim. So there's nothing to worry about after the visit.
That's so crazy. It just seems too simple.
It is. It's so simple. It's very complex. But yeah, your employee gets in, they get seen, they get out. And the virtual visits, we've been doing them all along because we didn't have to worry about whether insurance would pay for it or not. And they weren't paying for it now. The CARES Act made them pay for it on equal level. And that's why all the clinics now are doing it because they can get paid for it. But before, they were making the decision to have people come in, often unnecessarily, to get care that they didn't never need to come in for. They could have done it over the phone. And so we do it over the phone all the time and always have.
Yeah. So if somebody had like a fear of maybe they got a dry throat or something, and they've been running a fever for a day or two, and they're fearing that they may have COVID, they could easily call you.
Yeah. And right now, because we know what the state's doing and we're keeping on top of what's kind of going on, is we'll say, okay, go to the state site or come in, we'll swab you for a strep and, or, just depends on the situation.
Right.
Are you running a fever? Or, we screen for high risk stuff and go from there.
Yeah. That seems, this is interesting too, getting back to, like it was talking about annual benefits. It said every year CFOs ask their human resources team for a budget increase target.
That's my favorite section of the book.
I know, yeah.
Like,
and then the overburdened and risk-averse nature of HR as most organizations to preserve the status quo.
Yep.
So the insurance companies know this and typically come in with an increase. So I want to get that. The insurance companies know this.
Yes.
So they come in with an increase of 11 to 14%. Yep. The insurance brokers know this. Uh-huh. So they negotiate a less bad increase, staying below the CFO's budget.
A less bad increase. Yeah.
So now they're
every year
they're just, this is what's happened. You multiply it from, the 1960s or 70s to now. Yeah. This is where we're at.
And they don't want to change insurance companies if they can possibly afford it, because now every single employee has to go find a new primary care provider, and good luck getting in. Mm-hmm. But if you have a direct primary care piece, you can do anything you want in that other column because their primary care provider is not changing.
Yeah. And that part, to me, it's like playing our preying, I guess you could use that word, on. I always feel like it's these financial lions that are out there, and then there's all these little sheep just, that's almost what it looks like, because everything's about shareholder value. And, when you get these large companies, especially drug companies, we're facing issues with that now, looking at, whether it's, whoever it may be. And then now there's this big race to get a vaccine, and everybody's trying to get money involved into that, and drugs that may be effective, but there's no patent on them. They're saying no, so it's just this weird, you can see it, and all this garbage that's going on right now, when we should have cohesiveness and look after people, is mainly profits,
Right.
So, like when we get, cause I want to get a little bit more into the book, when we get into, like actual, because companies right now, because we're lean, we're in COVID, and everybody has decided to say, hey, like we have unemployment going on and all this. Because I even look at my company, it's like, okay, 2 or 3 people, unfortunately, had to go. And, so if I'm saying I'm going to charge $75, because I want to make this clear, because people are like, well, it's $75 extra a person. It's not $75 extra a person. It's because you'll be saving money. So I want to, and you said it, but I want to make sure it's like more simple and understanding. It's not just, okay, I have 10 employees, so that's, $750. It's where what does that mean when you're going to pull all the other stuff out?
So, you have, let's say, 100 employees, 75, so $7,500 on one line item. But if I could take 30% off your other line item, you're going to more than make back the $7,500.
Right.
And so you're taking out a lot of the claims out of the insurance process. And this is only for the partially self-funded employers that pay for their claims on the back end. So these tend to be the 50 plus, the larger companies. The smaller companies, I am an added charge. There's no way around it, but maybe you're offering nothing right now. And you should be offering something because your employees would like that, and it helps you be more competitive in recruitment and retention.
So if you're like, because I noticed a lot of tech companies and startups are using, because what you have is all around the United States, and it's growing.
Yeah.
And there's a certain name for it. What do they call it?
It's called direct primary care. And it's huge in, I know Denver, it's very huge. Everyone's heard of it there. I think it's pretty big in the Northwest as well.
Yeah,
Northwest.
that's something I was reading. And then but that's what they were talking about, like these small startups with 10 or less employees, and there's some private contracting software engineers to offer something like this is.
Yeah. I started this clinic 3 years ago, and I mainly focused on individuals to kind of get the kinks worked out and figure things out before I started rolling it out to employers. And there were 3 clinics similar to mine at the time, and now there's 5. So it's growing.
There's 5 clinics?
Yeah.
Just here in Albuquerque?
Uh-huh.
Oh, wow. But do you have 1 clinic or 2 clinics? Or
I have 1 direct primary care clinic.
okay.
I have some other things going as well.
Yeah, but I mean, are you looking at expanding, making more clinics? Or
Oh, yeah, absolutely. It's infinitely scalable.
Right.
As the clinic grows, we could bring on 1 or 2 large employers, and suddenly we'll be opened on the west side. And
right.
the model can also kind of be a partial on-site clinic where we're in your space 2 half days a week. If you're a big enough employer, we can come to you and kind of create that on-site clinic.
That would be amazing.
And it wouldn't really cost you anymore because it doesn't matter to us. We're offering care
right
wherever. We'll see our other clients as well from your site if we can work that out. And it doesn't really matter where we're at.
But, really, when you think about that, though, the amount of care, how many people would actually go? So if you were there, let's say you were there and you're a nurse practitioner and you're there,
yeah,
you're going to get people that are going to just, because it's so convenient, they would just stop in where normally they wouldn't, take the time. And there may be something that he's like, well, you should probably get this checked. And then you just save somebody's life or something.
Yeah, let's make you an appointment to get this looked into a little further or
Right.
run this test. I will say I've worked when I was an RN, I worked at on-site clinics quite a bit, and they're woefully underutilized. Employees do not like to use them because they feel invasive because it's at their company, at their job site. And so what I found the most popular is if you go in and do like sick care where they really can't avoid going in because they're actually sick that day, or you go in and you do labs. So maybe I wouldn't have gotten your 20 employees that never go to the doctor. They may have not done labs for years, and maybe we'll pick up on something. We often do, actually.
Yeah. All right. Well, I would think like somebody be like, oh, I have this. Can you look at this on my arm?
Yeah.
Or my neck or something? Yeah. You would get stuff like that?
When I was an RN and doing the on-site clinics, we tended to not. But if we already had a primary care relationship with an employee, and then we were also at the site, they already know us.
Yeah, right.
We have a different name. We're not just the person working for the company. We're Well Life ABQ working at the site. So it would have a different dynamic.
So that's something like as you get more companies on, then you would look at expanding to the west side, Rio Rancho, stuff like that, Las Lunas and so forth.
As it kind of depends on the company's needs as they come on board.
Right. Oh, this is interesting in the book. He talks about this, and I want people to understand this. The scope of the opportunity is 150 million American lives that are covered by fully insured or self-insured health plans. So if you take, and these are numbers, if you take approximately 10,000 employee year healthcare spending, is often the second largest expenditure of companies after payroll expenses.
Right.
So it's payroll, and then it's
healthcare, and you don't know what you're paying for.
And you don't, exactly.
You don't understand what your second biggest line item in your budget is. You don't understand it.
And he goes, it is fully known, he says this is fact, that at least 10%, and he says it's closer to 20% of this spending is fraudulent.
Yeah.
And a further 20+% of this spending is either wasteful, duplicated, unnecessary, even harmful.
Right. So I'm so busy. If I'm working at a typical clinic, I have somebody come in and they have a thyroid problem, and I am so busy. I'm 20 minutes behind. I'm like, here, go see this endocrinologist. I don't need to do that. If I have 30 minutes where I can sit down and talk to you and look over your labs and I can take care of your thyroid, it's well within my scope of practice to do that. So I'm not going to shovel you off to a specialist unless I absolutely have to.
Right.
And so it improves your continuity of care. It reduces duplicated efforts. And these are just the nuances of how we can save money. This isn't even the bulk of how we save money, but it improves your quality of care and it saves money.
Yeah. And he was talking about, he said like back of the envelope math, which is really cool. He said 175 million Americans times 10,000 a year average spending on health benefits, 10 to 30% unnecessary spending. We have 175 billion to 525 billion of GDP. That's just nuts. When I saw that,
you really add it up, start multiplying it.
And then you think about everything that is, hundreds of billions of dollars, and then you're like, this is a huge, catastrophic problem.
Yeah. Yep.
I mean, it's crazy.
And companies feel it. in Albuquerque and beyond all day long.
Yeah, and he said this. This is the quote that I want to get to. I had it on my other notes. He said, "Imagine if a foreign country was causing this kind of collateral damage on our economy. We'd go to war in a second." I mean, we would if it was that hundreds of billions of dollars.
Yeah.
Yeah, and so one of the he talks about 5 high impact lever points to focus on, and we kind of got into primary care a little bit.
Mm-hmm.
Transparency of pricing, which I think, we got into that a little bit too. And then employee concierge services, which you just brought, because these are the 5 benefits. Independent third-party administration of health plans. What is that? I didn't understand that when he said independent third-party administration of health plans.
So as a nurse practitioner, I had to go through a steep learning curve to understand companies and what they were going through. And so a lot of the terminology I don't fully understand. But a third-party administrator is a company signs on with a TPA, and they act like an insurance company. And so I've been an employee of large companies, and many people may be listening to this are employees of large companies. They don't understand, they don't realize that they're actually a TPA in between them and the payment. It's not really a health insurance company. They act like, so it would be New Mexico Health Connections, or I think they're calling themselves True Health now, or I might have that backwards, but there
nice
could be,
word, true.
Right? There could be a third-party administrator in there, and they're not, the health insurance company, the quote-unquote health insurance company, they're not the ones paying the cost. It's the employer paying the cost. The company's paying the cost. They have this big pot of money that they're going to use for health expenses on this calendar year, and the TPA just administers the costs. So it's the employer that's getting screwed. Excuse my language, but
no,
that's they're the ones. And as it goes through that TPA process, it gets wildly inflated, and the employer, the company, it gets wildly inflated, and then it gets discounted a lot less than it got inflated. So the employers, all they see is X dollars got discounted this much because my third party administrator is working hard for me, and I'm going to pay this much. And they did have no idea they could have paid 90% less.
Yeah, I like back in the old days, like it's just overinflating prices. You can have something for $19.95 and then put a big X across it and charge $11.95 or $9.95, and then it looks like you're saving all this value.
Right.
And when actually the item is worth $3.95, Yeah, that's crazy. So and then number 5 was the heightened fiduciary oversight on health insurance spending.
Yeah, he makes a pretty bold statement. I don't know if you kind of picked that up out of the book, but he says it's a company's fiduciary duty to get a hold of these health costs, and that it is no longer acceptable to just accept the status quo of the less bad rate increase of 10%. That's not okay, because you can save 30%, 40% off of that. So why aren't you doing it?
Right.
And it's because we're stuck in the status quo. It's because the overworked HR person is like, oh my gosh, I can't add one more thing. And really you're adding something that's going to save a lot out of the other end. And so it's hard to see that when you first start out. But we do a lot of the legwork when we're adding a company, because obviously we're pretty motivated to get people going.
Right. Well, I think also, like whether you have a company of 10 or whether you have a company of 1,000, I mean, you have plans that will.
Yeah.
You'll help either or, because I want people to understand that, this isn't just for, I don't have 100 employees.
No, we're doing employee companies of all sizes. And it just kind of varies in how we benefit those companies based on their size and how their health benefits are structured right now. And so that's the differences.
Yeah. And he says, and like you said, it's, a fiduciary responsibility, but he says it's probably the biggest elephant in the room.
Right.
When you look at, especially if you're a CFO or whatever, and you're looking at, we're always wanting to cut costs. We're always trying to run more lean, we're always less staff,
Right.
And it's amazing to me how we just overlook this whole side of things. That's the second biggest cost besides payroll.
And we're the frog in the pot too. I mean, we've been, the water's just been getting turned up and up and up, and we're just sitting there boiling, and we have no idea. Yeah.
Yeah, he uses this word, which is funny. It's kind of a religious word. He says, it is sinful that such a low-hanging fruit for cost containment is right under executives' noses and has been largely ignored.
Yeah. He makes some bold statements.
Yeah, I like it.
I love it.
And then one of the things that he talks about, because he's talking specifically to like CEOs and stuff, and he's trying to, have it make sense to them. He mentions 3 things in the book, and I want you guys to look at the book, especially if you're thinking like this would be something that we could do, he says not only is he speaking directly to you, and I don't think it, it's not just you. Yeah, you could have the title CEO, but you're like, really, I do everything at work, and put that title you. You know what I mean? If you own a business, it should be business owner or something, But I think he was
Company's
going for
guide,
more larger companies. But he said this that it is direct. The book is directly, and I think that's why the language is so harsh on the oversight of the financial side of things, because he is talking to a CEO, and that's shareholder value is everything with that. And then number two, he does not shy away from the complexity of employee-sponsored healthcare. He unpacks and frames it in a way that a business leader can engage with. So the language is businessy. It's not like, because I don't want people to think this is a medical book.
No, not at all. In fact, it was a somewhat hard read for me because I'm not a business person,
right?
At my core, and some chapters I still don't understand. But it's definitely for companies.
And it's really straightforward. I mean, as far as I was going through it, I could grasp some of the terminology. I had to look up because I don't know healthcare.
I thought he did a good job.
But as far as being real straightforward, and actionable, I think that was a really good, like, these are certain things that you can do right now.
Yeah. And he's such a believer in what he's writing. This book is actually available for free in a PDF download. So
yeah, I think you're the one that sent me the link, right? I think you sent me.
I think so.
Yeah, and it's on the.
I bought the book because I wanted a physical copy.
Yeah, she has an actual hard copy, here,
but it's free.
Yeah, and it's at the Rosetta.
Health Rosetta.
Yeah, Health Rosetta, and I know you have to put like it's like a lead magnet.
Yeah, they want your information.
Yeah,
for
marketing,
sure,
but you can get it for free. Yeah, but I think Kindle. I think it was $7.99 or something like that on Kindle
right.
on Amazon. Yeah, so it wasn't that much.
He's trying to get the word out more than anything. The book is not how he's making money.
Yeah, and I think the kind of to wrap this all up when we begin to look at it is the massive inefficiencies and ineffectiveness of the industry. I mean, that's and that there is a solution.
Yeah, I think we all know it's massively inefficient. I think we all know it's wildly inflated. There's probably nobody in the room that would argue with that, but very few people understand that there's solutions happening right now. It's right in front of us and it's working.
Right. I mean, I think you're a testament to that. I mean, your clinic is the perfect example.
Thousands of other clinics across the country that are making it work, and it's been working. Yeah,
that's cool. So if somebody wants to, maybe a business owner is listening right now and they want to get a hold of you and have you sit down with you or your office manager, have you sit down. What's the website again? Is there a way to email you, or how does that work?
Yeah, so manager at wellifeabq.com is the best way to email us and just get started with scheduling a free business review, and we'll reach out to you and get on your calendar and you get on ours, and we'll talk about what your challenges are and how we can help. And if you just want to go to the website and look around, it's wellifeabq.com. So WE, and there's 3 L's, so LLLIFEABQ.com.
And are you taking independent individuals?
We do. We still take individuals.
Okay.
Yeah,
because if somebody's listening and they're like, I'll pay $75.
Yeah, and some companies, maybe the owner's like, okay, well, I'm not really sure I want this for my company, but maybe I'll check it out first, and then we'll roll
really
it
cool.
out.
Yeah. So that if there's if somebody's, they could be listening to this podcast and say, I'll try it for myself first.
Yeah.
Maybe now, do you have like family plans, like with husband and wife, or is it 75 a person?
No, it's when we talk about companies, it's $75 an employee, but it's actually the individual, $75 for the first individual and $30 for each additional member after that.
Why did you just only charge $30?
Because we find so you think, okay, so a family of 4, they're like what, 145, something like that. They're busy. They're not going to be there every month.
Right. Right. Yeah.
One family member gets to have a problem.
Kid. Yeah.
At a time.
But still, $30 is not even a full visit. If you take your 10-year-old kid that has the flu, runny nose, you take them to a clinic. That they're going to bill the insurance company what, $300, $500?
Yeah. By the time it's all said and done, yeah.
And then there's prescriptions.
They're going to charge them for everything they can.
Yeah. How much I'm just going to be off the cuff real quick. Like everybody gets those Z packs and stuff like that. Is that, and those are those expensive? Are those?
Gosh. You're putting me on the spot, but I think my Z packs cost.
Just
And so
curious.
there's some medications that I can carry.
Like, I know you do a lot of generic, and you have
Yeah.
a pharmacy that you work with, right?
We also work with a pharmacy, but in-house.
Or you make your own drugs in the back?
No, definitely not. That would definitely be a violation of some big rules. We're not actually allowed to even count medications. We can't repackage.
Right.
So a Z-Pack is something we can carry because it's already packaged as a Z-Pack.
Oh, okay.
And I think they're about $6, $7.
No way.
The whole pack. Yeah.
A Z-Pack is like $6-7.
Yeah.
Because I know that everybody always gets Z-Packs when you go to the doctor. You know, they
Right.
always give you a
And
Z-Pack.
coming to us, you get it. You don't have to go to the pharmacy to get it. You can just get it while you're there.
Oh, while you're, oh, wow.
Yeah, because we have it actually in-house.
I think that's a great idea. Like, if you're a business owner, try it. Like, you
Right,
know, yeah.
yeah.
I mean, try it for yourself.
Yeah.
See how,
It's very common that we'll bring the first member will come in, they have some sort of chronic health condition that they
Right.
want to get looked at. So they're checking us out, they're trying it out. And usually within a month or two, their spouse is signed up
really?
because they loved it.
Yeah. That's cool. And I know we're going to get into, because we're going to be doing some more podcasts and stuff like that. So this will be fun. And I kind of wanted to like do one podcast or maybe a couple, depending, kind of walk through the steps of how you experience care, you know?
Yeah.
So we'll use me as a guinea pig. I
Yeah.
think that'll be
Sounds
funny.
great.
Yeah.
Yeah.
Maybe we can find something, you know, that I'm going to die in 3 months. But.
No, let's not do that.
No, I had my blood work done probably 6 months ago or whatever. And so, because that's something a lot of people don't realize is how important that is. You know, like for me, it's like, and I don't think that's like the test all of all tests, but
Yeah.
you can catch a lot in
You catch
blood
a
work.
lot in blood work. Yeah. And people, you know, who nobody wants to go to the doctor. You schedule an appointment 2 to 3 months out.
Right.
You go to the waiting room. You wait 45 minutes if you're lucky, past your appointment time, and then you get 8 minutes with the doctor, and you leave more confused than when you walked in.
Yeah. It's like, oh, all your stuff looks good.
Yeah,
Yeah.
or you have a medication and a referral and a test order, and
Right.
you don't even know why because nothing was explained or it wasn't explained.
Do you know how many
properly.
times I've gone online and like took my blood results, printed out on a PDF, and then I go through each one and read.
And everyone says that you have cancer.
Yeah, that's the big one. But no, but I mean, just trying to read and understand each one, like where's proper levels, you know, for a 47-year-old guy, you know,
Yeah.
you know, like and trying to figure all that out. Because when you do the blood work and then you go see somebody, it's going to be 10, 15 minutes, and they're just scanning through. Oh yeah, looks good.
And the difference is you go in and you say, okay, I have a stomach ache or
Right.
I have a headache. Okay, let's get some labs. The labs come back. They're like, okay, you look fine. You're like, but wait, I still
Yes.
have the stomach ache and I still have the headache. So
Right.
we don't do that. We're like, okay, your labs are fine, but you still have a stomach ache.
Right.
So let's keep investigating.
And I saw something on your website too, because it's real, like hormone therapy and stuff like that has become really popular. So is that something that you offer too?
Yeah, so the general just hormone replacement management, that's part
Right.
of the membership. But if somebody wants pellets,
Right.
then there's an additional cost. But anytime
And you
there's
talk about the pellets on your website.
Yeah,
right?
anytime there's an additional cost, you are notified in
Right.
advance of what that's going to cost. You're not surprised a month
Right.
later.
Yeah, it's crazy. Last blood work I got, they said my estrogen was really high. So
Oh,
I thought
really?
that was funny. Yeah,
Oh.
I was like, oh, I must be
I can
more
help.
like
I can help unpack that for you.
sentimental. Maybe I'm more
I
sentimental
can
or
fix
something.
that for you.
Because I think don't you start when I start getting like breast and then my stomach. Yeah, it's like more
It's
female
called
stuff. Yeah.
aromatization of testosterone.
Is that what it is?
Mhm. I
Oh,
can fix it.
My goodness, that's ridiculous. That's funny though. I started laughing the minute they told me that.
Yeah.
Because I think it's like
It's actually pretty progressive.
it's
They
like
even
0
checked
to 60 or something like that.
it. For men, I forget what the estrogen.
I forgot
think it's
what
only
it
up
was.
to 20 for men.
Or maybe it was, but I was like 17 or 18 or something. Yeah. So I'm like, oh my goodness, I'm turning into a woman.
No. You're not.
I was joking. Well, cool. Everybody can go to wellifeabq.com. If you want to have you go through their books and look and see how much money they can save, you're willing to do that too. You know, say here an HR person or somebody can say, hey,
Oh,
Casey,
yeah.
here's how much I'm spending. I don't know these numbers.
Yeah,
Can
you
look at
had
these?
actually asked how somebody would get on board, and I think we kind of got lost there.
In the estrogen,
yeah. We got lost in the estrogen. No, so one of the ways that I can show a company how I can save them money is by looking at their current claims data. And so you were talking about your labs. I'd love to see your explanation of benefits through your insurance. Do you have insurance?
Yes.
Okay. Through your insurance company right now, and just see how much it would look like your labs were supposed to cost you, and tell you that how much they might
That
have
would be
actually cost
interesting,
you.
yeah.
We could break that down.
Yeah,
in
because
real life.
your labs are like crazy cheap. I mean,
Right.
you said it earlier.
Yeah, I'd like to see what it looked like your labs were
Yeah.
supposed to cost.
I'll have to see what I have in there.
But what we
email.
can do for companies is we look at their current claims data,
Right.
and third-party administrators, insurance brokers, they don't like to give it up They do not want to give you that data. In fact, a lot of companies that are listening to this have clauses that do not give them authorization.
So you could piss one
data
off if you ask them. What would be the question to ask them?
Oh, they get nervous. They get nervous when you're like, hey, can I get my claims data for the last 6 months? First of all, good luck getting a response within 2 weeks.
Really?
Second of all, I have a company that has been working on trying to get actual data. It's been about 3 months now. All they've gotten out of their broker so far is total spend.
Wow. So there's no transparency there then?
No, they don't want to show them the claims data. And they'll say things like,
so HIPAA, are you just trusting at the end of the year when they go through? You're just trusting?
Yeah, they'll say, oh, it's a HIPAA violation to see that. But this stuff is depersonalized, the claims data. It's not a HIPAA violation. That's crap.
Wow, so you got some inside scoop here.
I can't remember if it was in this book they were talking about or a different book. I think it was in a different book. There's a different book called The Price We Pay that's a little more individual kind of the crap that happens in healthcare. It's a good read too. This one was more about companies, but
right. So so you can even go through all that, and even if they can't get their data, you could still go through their costs and kind of see.
All I would be able to say is like, okay, here's your total healthcare spend. I could probably save you 30% at the end of the year on that. If I don't have actual data, I can't look and say, okay, you paid X amount for this thyroid panel when you should have paid this much.
Right.
I can't do that line by line.
But the coolest part is you can pull all that out just by using you. Right. I mean, you can pull a lot of that out of there. So it's you don't even really need to get your data. They just need to sign up with you.
Yeah, but they have to step out a little bit on faith if I'm not able to break down their claims data. But if they can get their claims data, I can prove it.
Yeah, that's cool. Yeah, so everybody get your claims data.
Yeah, start the process now because it's going to take a while.
3 months, that's crazy.
Yeah, they still don't have it.
Yeah, I don't. See, that shows me. That shows me if you're not willing to show me the price of anything and you're selling me something.
Yeah,
I mean that's just common sense.
They're never going to get it.
Yeah. That's nuts.
I'm actually going to encourage them to change their broker. That's a different topic.
Yeah, and then you can also consult with people on that if they're using you, and you have like you said you have options for catastrophic.
Yeah,
like
it's
if
called
cancer hits or something.
Yeah, it's called cost share.
Okay,
and it's not for everybody. It's probably for about 80% of the people out there.
Do you know good brokers and stuff?
Oh yeah.
Okay, cool. I do. So perfect. So if somebody is looking for that,
yeah, absolutely.
that would be something.
She's actually my best friend. I've known her since she was 13, but she's been doing it. It's her first and only career. So 25 years of health insurance.
And she's the one that's going to get certified or trying to?
Yeah, she's the one.
Yeah, through with this guy with the book.
Because we talk a lot. So she's probably the only broker in the city that understands direct primary care inside and out because
that's cool.
I bend her ear constantly. So.
So it's not only that, but you can, and then is there savings with that too? If you're looking like, she probably knows, like if you say, hey, I'm with KC with their company primary care, and I'm looking to cover, something that horrific happens, car accidents, cancer or whatever. Yeah. So she can
when
match
companies start throwing stuff at me that I'm like, I don't understand that, that piece of the health benefits pie. That's when a broker would come in, a broker that you can trust, should come in and help.
And so she can put that puzzle piece together.
She can put that, yeah.
Yeah, because it could be scarier. Like, okay, yeah, you can save me 30%. I'll go with you, but I'm still worried about this other side. Or maybe I should just dump them. And yeah, I can go with you, but then who else do I go with?
Yeah, I don't encourage companies to dump their health benefits. Okay. I'm just saying, self-funded companies, I'm saying I can pull money. I can pull claims out of their total spend
and save them money.
A lot of money.
And they get 100 times better healthcare.
And their employees love it.
Yeah, employees love it. That's awesome.
And one objection we get a lot is that, we can't tell our employees to go see just one provider. And that's all we are right now is just one clinic with 2 providers. And you're right, you can't force them to go see somebody, but you can offer it to them and they can opt in, and you only pay for the ones that opt in. And you get early adopters, and then those early adopters tell their coworkers, and then before you know it, a large percentage of your population is in the program.
Yeah, that's cool. I love that. I think it's cool. It's welllifeabq.com. Go on there. You'll see it, especially for everyone. It's literally for everyone.
Yeah, so, I can't think of a scenario that it's not for. Yeah.
That's awesome. Well, cool. Well, thanks, Casey. Appreciate you being on the podcast again. We'll have another one very soon.
Great.